Look closely the next time you're in front of a mirror. Not at your wrinkles, not at the gray hairs. Look at the very edge of your iris, that colored ring around your pupil. If you see a thin, milky white or grayish halo tracing around the outer edge, most people will tell you that's just getting older. A cosmetic thing. Nothing to think about. I want to tell you why that assumption is incomplete, and in some cases, dangerously incomplete. Because that ring isn't pigment. It isn't a trick of the light. It's actually made of something most people would never guess. It's fat, cholesterol, to be specific, quietly depositing itself in the clear tissue of your eye. And depending on a few things we're going to walk through together, that ring can mean almost nothing, or it can be one of the earliest visible clues that something serious is happening inside your arteries. Years before a standard checkup would ever catch it, by the end of this video, you'll know exactly how to tell the difference and what to do about it. I'm Dr. Thomas Ellison. I've been practicing medicine for over 10 years, and if there's one thing that stayed consistent across a decade of patients walking into my office, it's how often something gets caught almost by accident. A patient comes in for something completely unrelated, and during the exam, I notice that ring, and that small observation changes the entire conversation. That's exactly what happened with one of my patients. I'll get to her story in a moment, because it's the clearest example I can give you of why this matters. But first, you need to understand what you're actually looking at when you see that ring, because the explanation is more interesting than you'd expect. If you're someone who likes evidence-based health information explained clearly, without the fear-mongering you find on half the internet, consider subscribing. We're trying to reach 2,000 new people in this community this month. And videos like this are how we do it. The medical name for this ring is Arcus Senilis, sometimes also called corneal Arcus. Let's break that term down, because once you understand it, you'll never look at it the same way again. Arcus simply means arc or ring. Senilis refers to aging because this is something doctors have observed for over a century, almost always showing up in older adults. Here's the visual. Imagine the clear, dome-shaped front window of your eye, the cornea. It's normally perfectly transparent, like a windshield. Now imagine tiny amounts of fat lipids slowly settling into the outer rim of that windshield, layer by layer, like sediment settling at the bottom of a glass of water that's been sitting untouched for years. And that's essentially what's happening. Fatty deposits accumulate in the peripheral layer of the cornea. Doctors call this layer the corneal stroma, and over time, enough builds up that you can actually see it without any special equipment. Just a mirror. Here's the part most people get wrong. They assume because it's visible on the outside, it must be a cosmetic, surface-level thing, like a wrinkle, like a sunspot. But this isn't sitting on top of your eye. It's inside the tissue. And lipids don't just appear inside body tissue for no reason. They get there because they're circulating somewhere else first, in your bloodstream. So when I see that ring in a patient's eye, I'm not thinking about their eye at all. I'm thinking about what's happening in their arteries. And that's where this gets serious. Now here's the question I get constantly. Doc, my father had this ring in his 80s. Was he in danger? And the honest answer is, it depends almost entirely on one factor we haven't talked about yet. A factor that changes everything about how worried you should be. I'll explain that factor in a few minutes. Because to understand it, you first need to understand exactly what this ring is connected to, and it's not just one thing. Let's talk about why a fatty ring in your eye would have anything to do with your heart. Think of your circulatory system as a vast network of highways and cholesterol particles as cargo trucks driving on those highways non-stop, 24 hours a day. Most of the time, that cargo gets delivered exactly where it's needed. Your cells use cholesterol to build hormones, to maintain cell walls, to function normally. It's not the villain people think it is. The problem starts when there's too much cargo on the road, or when the type of truck carrying it is more likely to crash into the highway wall and dump its load there. That dumping in your arteries is what eventually becomes plaque, the hard, narrowing buildup that restricts blood flow and, over enough years, can trigger a heart attack or stroke. Now here's the connection. The same circulating lipids that build up plaque in your arteries can also deposit in other tissues around your body, including, as researchers have observed for decades, the periphery of your cornea. This isn't a new idea. Doctors have suspected a link between corneal arcus and atherosclerosis artery disease going back over 50 years. And while that link has been debated and studied carefully because correlation in medicine is never simple, the research keeps circling back to the same pattern. One especially telling study looked at patients with a severe genetic cholesterol disorder. Researchers at the National Institutes of Health measured corneal arcus alongside actual calcified plaque scores in the aorta and coronary arteries. The patients who had visible corneal arcus had dramatically higher calcified atherosclerosis scores than those who didn't, and a strong, measurable correlation between the size of the eye ring and their lifetime. The cholesterol burden, let that sink in for a second. The ring in the eye wasn't just associated with cholesterol problems somewhere in theory. It tracked, almost like a dial, with how much arterial damage had already accumulated. And more recently, In 2025, researchers studying patients with familial hypercholesterolemia, a genetic condition we're going to talk about in a moment, found that those with corneal Arcus tended to have higher levels of something called lipoprotein A, or LPA for short. We'll come back to that marker because it might be the single most important number on a blood test that almost nobody gets checked. Here's something else clinically important, and this is a detail I want every person watching to remember. If the ring appears on only one eye instead of both, that's actually considered more concerning, not less. An asymmetric, one-sided Arcus can be a signal to investigate the carotid arteries, the major vessels supplying blood to your brain, for blockage on that same side. So this visible ring in the eye isn't just a curiosity. In certain patients, it's a physical echo of something invisible and far more dangerous happening deep inside the vascular system. Quick question while we're here, and I'd genuinely like to know in the comments, have you ever noticed this ring in your own eyes or in a parent's or grandparent's eyes and just assumed it was an aging thing? Drop a comment below. I read these, and it helps me know what to cover next. Now let's get to that one factor I mentioned earlier, the thing that determines whether this ring is something to mention casually at your next physical or something to act on immediately. Age %, specifically the age at which the ring first appears. In adults over roughly 45 to 50, a corneal Arcus is extremely common. Studies have found it in a large share of older adults, and in most of those cases, it reflects the normal, gradual cholesterol changes that come with decades of living. Not necessarily a hidden genetic time bomb. It's still worth knowing your numbers, but it's not automatically a 5-alarm fire. But here's where it changes completely. So, when that same ring shows up in someone younger than 45 asterisk, sometimes doctors call this Arcus juvenilis to distinguish it. That's a different story entirely. In a younger patient, this is considered a strong physical clue, pointing toward a serious, often underdiagnosed genetic condition, familial hypercholesterolemia, or FH. Let me explain the term plainly, because the name sounds intimidating and it doesn't need to be. Familial means it runs in families, it's inherited. Hyper means excess cholesterol. Simply means cholesterol in the blood, so an inherited condition causing excess cholesterol in the blood from birth, regardless of diet or exercise. Here's the analogy I give my patients. Imagine two houses on the same street, both throwing the exact same amount of trash out every week. One house has a recycling truck that comes by efficiently and clears it out. The other house has a broken truck that only picks up half the trash every single week for 40 years. Even though both houses produce the same lifestyle trash, one ends up buried. That's FH, the genetic mutation most often in a gene responsible for clearing LDL cholesterol out of the bloodstream, means the body's truck for removing cholesterol doesn't work properly from childhood onward. So even a person eating well and exercising regularly can be quietly accumulating arterial damage for decades before anyone thinks to test for it. And this is the part that should genuinely concern you. FH is estimated to affect roughly 1 in 200 to 1 in 250 people. Most of them don't know they have it. Many go their entire lives undiagnosed until a heart attack happens, sometimes shockingly early in their 30s or 40s, which is exactly why a visible sign, like a young onset corneal Arcus, matters so much. It can be one of the very first physical clues, sometimes appearing before a single blood test has ever been ordered. There's a second visible clue I want you to know about, because it often shows up alongside the eye ring: xanthelasma. These are small, soft, yellowish bumps or patches that form on or around the eyelids. Usually near the inner corner of the eye, they're made of the same kind of lipid deposits. They're painless, they don't affect vision, and most people mistake them for a skin issue or simply ignore them. To be fair and accurate with you, xanthelasma can occur even in people with completely normal cholesterol levels. It's not proof of FH on its own, but combined with a young onset corneal Arcus, a family history of early heart disease, or both, it's a pattern worth bringing to your doctor's attention, not dismissing. Let me tell you about a patient I'll call Margaret. Margaret was 58 when she came to see me. Not for anything related to her heart. She'd come in for a routine physical, the kind of visit most people treat as a formality. Healthy weight, active, walked her dog every morning. By every outward measure, she looked like someone with nothing to worry about. But during the exam, I noticed that a faint grayish-white ring tracing the edge of her iris, both eyes. And when I asked her how long it had been there, she said something I hear constantly. "Oh, that's just an old person thing." Right, my mother had it too. Her mother having it too was actually the detail that caught my attention, not because it reassured me, but because it raised a different question. I asked a few more questions about her family history. It turned out her father had passed away from a heart attack at 54. Her brother had a stent placed in his 40s. None of that on its own proves anything, but it's exactly the kind of pattern where I stop and think, this deserves more than a passing glance. I ordered an expanded lipid panel, not just the standard cholesterol numbers most people get, but specifically including LPA, the marker I mentioned earlier. Her LDL was elevated, but not dramatically so. The kind of number that might get a passing mention and a watch your diet comment in a rushed appointment. Her LPA, however, came back significantly elevated. That one number changed everything about how we approached her care. LPA is largely genetic, diet and exercise barely move it, and it's now understood as an independent, inherited risk factor for cardiovascular disease. Separate from regular cholesterol entirely. It doesn't show up unless you specifically test for it, and until recently, almost nobody did. We referred Margaret for additional cardiovascular screening. We talked through medication options designed specifically to address elevated LPA-driven risk alongside tightening her overall lipid profile. We talked about her children and the importance of them getting tested too, since this pattern can run in families. Margaret didn't have a heart attack. She didn't have a dramatic ER story. What she had was a quiet ring around her iris that, combined with a few careful questions, opened a door that might have otherwise stayed closed for years. That's the story I want you to remember. Not because every ring means disaster, most don't, but because the cost of checking is a simple conversation and a blood draw, and the cost of not checking, for someone like Margaret, could have been everything. Here's what I want you to sit with for a moment. Arterial plaque doesn't build overnight, and it doesn't announce itself with symptoms until it's already advanced, often until a blockage is significant enough to cause chest pain, or until it ruptures entirely and causes a heart attack or a stroke with no warning at all. That silence is exactly what makes this disease so dangerous. You don't feel your arteries narrowing. You don't feel LPA circulating at double or triple the level it should be. The body gives almost no symptoms until sometimes it gives you one ring around your iris quietly years in advance. So let's talk about what actually matters here, because awareness without action doesn't protect anyone. If you've noticed this ring, especially if you're under 50 or if it's asymmetric or if you have a family history of early heart disease, here's what I'd recommend asking your doctor for. Beyond the standard total cholesterol number, most people get LDL cholesterol, specifically the actual number, not just whether it falls in a normal range. Since normal ranges are population averages, not personalized safety thresholds. Lipoprotein A, or LPA, this is the one most people have never had tested. It's genetically fixed, meaning you typically only need to test it once in your life to know where you stand. New National Cardiology Guidelines, updated in 2026, now recommend that every adult get this checked at least once, yet most people have never even heard the term before watching this video. Apolipoprotein B, or ApoB, rather than just measuring how much cholesterol is floating around, this counts the actual number of cholesterol-carrying particles in your blood. Picture it like the difference between asking how much cargo is on the highway versus how many trucks are actually out there. Two people can have similar standard cholesterol numbers, but a very different number of particles. And particle count is often the better predictor of risk. If your doctor finds an elevated LPA, a notably young-onset Arcus, or a family history pattern like Margaret's, that combination is worth specifically mentioning by name, not just describing the ring. But saying the words, "I'd like to rule out familial hypercholesterolemia," or asking about an expanded lipid panel including LPA and ApoB, doctors see hundreds of patients. A specific, informed question like that helps fast-track you toward the right specialist rather than a routine follow-up months down the line. Now, knowing your numbers is one thing. What you actually do with that information is where most people either take control of this or quietly let it keep building for another decade. So let's talk about that. The good news, and there is real good news here, is that even genetically driven cholesterol problems are not a life sentence. They're a management plan, and one that works. On the lifestyle side, the research consistently points toward a few specific, high-impact changes rather than vague eat healthier advice. Increasing soluble fiber foods like oats, beans, lentils, and apples has a measurable effect on lowering LDL cholesterol, because soluble fiber binds to cholesterol in the digestive tract and helps carry it out of the body rather than letting it recirculate. Reducing saturated fat, found heavily in fatty cuts of red meat, butter, and fried foods, in favor of unsaturated fats from sources like olive oil, nuts, and fish, consistently shows benefit for lowering ApoB-carrying particle counts. Regular aerobic activity, even brisk walking most days of the week, has been shown to favorably shift cholesterol particle patterns over time. But I want to be honest with you about something important. If your LPA is significantly elevated, diet and exercise alone will not meaningfully lower that specific number. It's largely inherited and genetically fixed. That's not a failure on your part. It simply means the conversation needs to shift toward your doctor and what's medically appropriate for your overall risk, which may include cholesterol-lowering medications. And in some cases, newer therapies specifically targeting LPA that are currently being studied and increasingly used in higher-risk patients. I'm not going to stand here and tell you a supplement or a specific medication is right for you. That decision belongs in a real conversation with your physician, based on your actual numbers and history. What I can tell you is this: knowing your numbers is the single highest leverage thing you can do, because it turns an invisible, silent risk into something visible and manageable. The same way that ring in the mirror turned Margaret's invisible risk into something we could actually act on. Here's how I want you to think about that ring from now on. It is not a verdict. It is not proof that something terrible is already happening. In most older adults, it's simply a common, largely benign marker of the cholesterol changes that come naturally with age. But it is also not nothing. It's information, a small, free, visible signal that your body is giving you completely unprompted simply by looking in a mirror. Most warning signs in cardiovascular disease are silent until it's too late to act early. This one isn't. This one shows up years in advance for free, asking you to pay just a little bit of attention. That's not something to fear. That's something to be genuinely grateful for. If this video helped you understand something about your own health, or made you think of a parent or partner you want to share it with, that's exactly the kind of thing this channel exists for. Subscribe if you want more clear, evidence-based explanations like this one without the fear-mongering or the hype. Like the video if you found it useful. It genuinely helps more people find this information. And drop a comment letting me know, are you going to look a little closer in the mirror tonight? Take care of yourselves. I'll see you in the next one.